Namaste and welcome to the fourth season of Youth TV show produced by Leadership Academy. Youth TV show is an attempt to foster the creativity of young minds by providing a platform to address the issues that concern our society. My name is Shia Paudel and I'm an intern at Leadership Academy. In today's episode, we are featuring the interaction with DIG Nawa Raj Silwal, the spokesperson of Nepal Police, on the topic awareness on drug issues among youths.
Which drug is more sold to the youngsters? Or in all the cases?
In Nepal, actually, the mostly used abused drug is buprenorphine and diazepam. They are ampoules you can find in the market. So they mix that liquid together and they inject. The widely abused drug is diazepam and buprenorphine. And they also take amphetamine tablets, ATS. Amphetamine tablet is something that gives you strength. Pseudo strength that activates your central nervous system, and amphetamine type tablet is another commonly abused drugs among the youths.
How can you stop addiction?
I want your assistance in it because addiction cannot be stopped. All we can stop is getting people into drug. Once you are already in drug, once you are already in addiction, the only thing we can do is take him to the rehabilitation center and treat him. The addiction cannot be controlled by us. It can be controlled by the trainers, by the practitioners who work in the rehabilitation center. So we can stop people from getting into addiction. We can stop people from getting into drug. That's the best way of stopping drug anywhere in the country. And how do you know if someone is in drug? This is a very important issue actually, because you all should know. I've told you what is drug and what are the effects of drug. Once you are in drug, it's very difficult to get away from it. There are ways to actually treat people in drugs. Rehabilitation centers. There are a lot of these centers which actually provide treatment, counseling, and 10, 15, 20% of them actually they get recovered. They go back to the society, but they always bear a risk of always getting back to the drugs. The withdrawal kind of tendency is very high. So when someone starts using drugs, his behavior changes. As I stated earlier, he or she remains quiet most of the time. Whoever takes drug, he or she remains quiet. So if someone is quiet, if someone is someone being quiet is a new thing for you, then you should ask whether he or she is taking your friend is taking drug and doesn't want to talk with other people. Person in drug doesn't want to talk with other people. He or she enjoys being on his own, and so cynical attitude and shout. Sometimes if you ask questions or you try to get involved in conversations or whatever, and he or she would actually react in a cynical manner and stare continuously with dilated eyes, looking continuously to something or to someone in a dilated. You can see at his people, and you can see that the people are dilated, and you can probably guess that he or she is involved taking a drug. Staggering gait, splutter voice, and shivering while walking. Person under a drug cannot walk straight. Stagger gait, and even voice shivering and spluttering. And difficult to look in the light. He or she cannot see in the light. And depression and worry without reason. And because people under the influence of drug looks depressed all the time and thinks all kind of negative stuff, that he or she is not protected or something might happen to him or her, and that kind of notion you can easily read in his behavior, in his attitude or face. Looks serious and sits energyless. Looks serious and sits energyless, because when you start taking drugs, your energy level goes down. Drug extracts the energy from your body. So that is one aspect of knowing if someone is in drug or not. Shows indifference on the daily activities and friends associated with it. Indifferent kind of attitude, doesn't get along, speaks lies and bluffs. Whenever you ask something, he speaks lies. He bluffs. That's the tendency of drug abusers. No appetite and loss of weight. He or she doesn't want to take food, he doesn't feel hungry, he doesn't want to eat at all, and consequently it causes to the loss of weight. Signs of needles and spots in the body. Because if he is using needles or snorting, you can see signs in the body which can indicate that he is involved in drug abuse. And possession of substance, cigarette, papers, burnt notes, and plastic. These are the stuffs used in abusing drugs. So you can see in a person who actually takes drug, his rooms, under the pillow or bathrooms, in his pockets, you can find stuff like cigarette papers, burnt notes, lighters and plastics and substance of abuse, obviously. So I'd like to request you to actually, if you have siblings or brothers or sisters, if he is changing behavior, then go check in his bags, in his almari, in his bathrooms, or under the pillow. There could be some stuff hidden. And odor in clothes and in the bedroom. You can smell some kind of odor if someone is using drugs. It's not kind of common odor, but it's uncommon kind of odor that it can easily smell. And withdrawal symptoms in each interval. If he or she is taking drug, when the effect of drug goes out, when the central nervous system is not dominated by the drug, then he becomes, starts getting nervous, starts speaking, all kind of stuff, and that withdrawal symptoms would actually, present in the body, and that would want him to go back, get the drug again. So he would try to do anything to get a drug. If he doesn't have money, then he'll go steal, or speak lie, or even pickpocket, or even sometime you can't imagine steal stuff from other people and go buy the drugs. How do people get into substance abuse? How do they get into drug abuse? One of the most important element is peer pressure. If someone is taking drugs, then he would obviously want to increase the number of people taking drugs. He would want to enlarge his community, expand his community. So you'd pressure. Oh, you are such a smart person. You do not even follow me. Look, it's wonderful. You can feel wonderful actually. It's just like going to the heaven. It's wonderful experience. Don't you want to experience? It's life, man. Come on, go ahead. Just try it. So that kind of, and if you had 2 or 3 people already in drugs, they would, get some other people. One would say, oh, come do it. Oh, you're smart. You do not even consider us as your friend, so you don't want to take it. Fine, go away. Don't even show your face. So you'd feel, oh, let me try, because my friends are getting mad to me. If it is nice, let me try. So that's one area, that's one element. Peer pressure is something which drives so many youths into drugs. And curiosity, another one, oh, let me try. If it feels wonderful, wow, I will also want to feel wonderful actually. I would also want to feel it. So that curiosity also drives people into drugs. You take one time, you feel good. And you want to take it another time, 2 times, 3 times, and you get into addiction. Even if you do not want, you need it. So deliberately crafted plan. What happens is the drug pushers in the community, in the schools and colleges, they have their marketing strategies. What they do is they appoint the people who go do the marketing. So the smart-looking young girls would come, talk to you, and then even exchange the mobile numbers. So youths, young, smart guy like you would say, oh, wonderful kid. Oh yeah, nice knowing you. Can we sit for a tea? Fine. So you go for a tea. Next time, go meet her. I've got something. Would you like to try? No. What is it? I don't want. I'm taking it. No man, it's good. You feel better. Just try it. You don't have to pay. So you take 1 time, 2 times, and you want it. 3 times you go, well man, I don't have it. I have to buy it, So get money from home, from your parents, steal. And I can, give it to you. So ultimately, when you are in drug, you need money to buy it. So you start stealing money from your parents, stealing from friends, schools, teachers, and all that. So there are people planning to get people in drug. That is how their business expands, and they make money out of it. They do not care if youths of a country are destroyed. When you are in drug, you are a liability. And I've seen many parents actually coming to me, and they say, they look so sad, and they even say, can you imagine, parents would in any way say such things. They come to me and say, sir, every morning I pray with the God, if my son would die soon. I said, why? Because if he dies, he will be happy also, he'll be gone. And we also undergoing through a lot of suffering, we'll be happy too. So we want him to die as early as possible. We can't feed him, give him poisons because it's illegal. But we want him to die. Can you imagine parents asking the God to give their children early death? The pain that creates. If one individual in a house is in drug, the whole family is distressed. They cannot go about doing their work. If he is an engineer, he can't go work. And if he builds the bridge, it collapses down. Because he is not concentrating, he is paying attention back home. Oh, my kid, what will happen to him? And what will happen to me? If a doctor and his son or daughter is in drug, he can't go about doing his profession. He'll prescribe, kind of wrong medicine to a patient. He'll subsequently die. This is a very serious issue. And environment and colleagues. The environment it also contributes to get people into drug. If the environment is if everyone is taking, obviously it is free. If it is not controlled, if you do not take drug, then the people taking drug would always behave you as a stranger. So you do not want to be singled out, and you probably want to get into drug. So colleagues, if you have friends who are taking drugs, get aware of them. Get away. Be aware.
What are the steps taken by that your office to control the abuse of drugs?
There are a lot of activities my office is involved in actually. This educating students is actually something that has to be done by the discipline of demand reduction. But we are getting involved in educating the students. That is one area my office is involved in. The other one area is we actually stop the production of narcotic drugs. You have seen police probably in the districts going to the cannabis field and then destroying the cannabis plants. That's another area we're working in. And we also control the pharmacies. There are a lot of, almost 40 plus pharmacies in Nepal, they produce drugs, the life-saving drugs. But they also have to produce this kind of drugs which are to be taken under the strict observation of medical practitioners or doctors. We also actually look into them, whether they are producing according to the license given to them, the quantity given to them, quality given to them or not. We work with DDA, Department of Drug Administrations. We work with them in partnership and control them. And we also arrest people who are involved in production, abuse and transaction of drugs and send them to jails. We also educate people. We cooperate with international agencies, we share information, and we work to make global effort to make world free of drug. We also want small component that contributes to the world to actually, lay in our hands together with the world leaders, with other leading agencies who are working day and night to make world drug free.
Is there any way to avoid the drug addiction from friends and maintain the friendship?
All right, if someone is already in drug, your friend is already in drug, you should not run away from him. If you isolate him, you will get into even severe drug abuse. So what you can do is help him, counsel him, take him to the doctors and talk to his parents and be with him and help him and do not let him lose his confidence. That's the best way, best responsibility of a friend, to save your friend from getting severe level of drug effect and bring him back to the normal life. So that's the duty of you all. Whoever is in drug, you can, in several way help him out of drug. Not isolating him, but putting him together and raising his confidence.
Which is the most dangerous or harmful drug?
All the dogs are harmful, but I would say the most harmful drugs are amphetamines. If you take hashish is not that severe harmful. Cannabis, because people have in several countries of the world, they have started introducing cannabis because hard drugs do several severe damage to your body. But cannabis does not affect as severe as any other drug. So hard drugs would be cocaine, white sugar, and amphetamine type of substance are very hard drugs, and they harm you to a level that you cannot come back to a normal situation at all. But the countries like Uruguay has recently actually introduced legislation which says they would want people to smoke cannabis because they do not have cannabis, they have coca. So people can stop using cocaine and get into hashish or cannabis. Cannabis will not do that big harm. And states in America like Washington and Colorado they have introduced legislation which allows people to smoke cannabis. And in Netherlands there is a city called Amsterdam. In Amsterdam you can go and you can smoke hashish. They sell it in the pubs and restaurants. So the harm level of cannabis is very low. Though it is a drug, it harms you, but it doesn't harm you in a manner that hard drugs like cocaine, amphetamine, or white sugar would harm you.
You said that marijuana would be legalized in some states. So will drugs be used as recreation in the near future?
No, I'm not saying that people will start taking drugs freely. No, because I'm just saying that since there was a question raised, I just said that because experts have started indicating that smoking cannabis does not harm as much as the hard drugs, they harm. So maybe in near future, countries would probably start recognizing cannabis as not hard drugs. It's controlled, but it's not really hard. So there may be a situation that people will quit using hard drugs and get into softer ones, and which will probably damage health minimally, actually comparatively, in comparison with the hard drugs it would affect less. So there may be a situation in 20-30 years down the line that the governments would recognize cannabis or less harmful drugs, so that the hard drugs can be avoided and public health can probably be protected.
Negative effects of some natural narcotics are not proven yet by the science. Some people demand the use of marijuana for medical purpose. Can it be legalized?
I do not say, because it's something the political parties and the parliament should consider. So this is just an academic discussion, I would say. I do not say that it has to be legalized or it is already illegal stuff. So as a law enforcement officer, I would say abusing cannabis or producing and selling it is a crime, and we punish them. But maybe in near future, the debate would go ahead, and then probably academics have already started speaking, and the political leaders will also start, debating in it, and the parliament, if it so decides, recognizes, then there may be a situation. But I do not think it is happening soon, and we do not encourage cannabis as something that we want people to smoke. No, it is punishable by law. Abusing, producing, selling marijuana is punishable by law. Thank you so much. My email is nawa.silwal@gmail.com, and you can even contract dial 100 and pass on any information to 100, and they will relay it to us. So if you have difficulty getting through my line, then you can dial 100 and pass on the information. If someone is involved in drugs, if someone is abusing drugs, someone is coming to your school selling drugs, pass his information to 100, and that 100 number will relay the information to us and will react. And that will be your service to the nation also. And if you have any issues that you'd like to ask me, you can email me. Thank you so much.
As I had mentioned in the class also, especially class 8, while teaching about these narcotics, I promised you at that time that you would be there in a talk program. Actually, today, more information you got, it has created awareness to you. And I hope it helps you. Because at that time also you decided to say no to drugs. Then definitely from today onwards, you all will do the commitment to say no to drugs. So on behalf of Kathmandu University High School family, a huge thank to Nawa Raj sir for giving such a valuable information.
We have come to the end of today's program. You can call the TYA office at 425-7250, or you can email us at youthtya@gmail.com for the feedback. We will be back next week with a new episode of Youth TV Show. Have a nice week. Namaste.